Thank you very much. So what I'll be covering today is Tusla's role as a regulator. I'll look at what we're currently doing, what we're moving towards, and what everyone will be moving towards in relation to the registration model, and then some conclusions. Now, just about Tusla in general, because I could go straight into just the inspectorate bit, but obviously I come from quite a large organisation where the inspection piece is part of it. So Tusla was established on the 1st of January this year as an independent agency where the HSE Children and Family Services were brought in, and the Family Support Agency and the National Educational Welfare Board. And of course, with the HSE Children and Family Services, the Early Years Inspection Service came with that and is now part of the agency. Now, the vision of the agency is all children are safe and achieving their full potential. So that's our general vision, and you can see how that fits in for me for the inspection service as well. And as I said, Tusla has a number of services it provides, and it's listed as one of the mainline services is the regulation of early year services. There's a look at the list in full another time. So Tusla as a regulator in early year services. So we are the independent regulator of early year services in Ireland, and our role is to promote quality and safety in early year services by monitoring compliance with the Childcare Regulations 2006. Now, we play a very discrete role, and part of the role of driving quality improvement, driving quality in the early years sector. There's loads of other players, and you'll see some of them today, and some of them might have spoken already, some may not be speaking today. So our role is as the regulator to look at driving quality improvements by monitoring compliance with standards. There's other initiatives out there. So for example, there's educational professional, just general drive of professional bodies. Public opinion lobbying, the power of the press and media obviously play a big part. Financial and commissioning, be it from the department, plays a key part in driving strategic change in this sector. The policymakers and legislators, and of course other performance improvement activities such as the mentoring scheme as well. So all in together drive change. So Tusla is just part of the pie in driving change. It should always be seen that way, but it fits into that whole quality drive. So how do we regulate for quality? So obviously there's standards for quality and safety. Now we don't set them, the department does. So what we do is we inspect and monitor against the standards and look at compliance levels within them. Through that we drive change by reporting on the findings, and obviously with reports, services should just take reports and make sure that they develop action plans and quality improvements out of them. We facilitate learning. Now that's something that we want to grow. Like the most recent example is the independent research, which I'll talk about a bit later, by Dr. Sinead Hannafin, but we'll keep doing that more. So we'll identify trends and we'll publish informative reports for people to drive improvements. And of course we enforce, which is another lever of change and quality for us. Now, how we do it again is predominantly by monitoring compliance and enforcement. So for monitoring compliance, we carry out inspections. They can be announced or unannounced. There's analysis of data. So we use data to make decisions regarding how compliant an organisation is. Now that's something we will very much be building on, is I want to move much more towards an intelligence-driven regulation model, is that we have more information coming towards us. There's already lots of information in the system as it is, but we want to have a system where we can identify high-risk services in a much more timely manner. At the moment that's very early, but we still do use data to make monitoring decisions. At the moment we investigate complaints. It's another key part and takes up a lot of inspection time. It's another area that we'll be planning to, we are reforming at the moment to move towards a much more centralised complaint system. And then of course, as I mentioned already, enforcement is another key part of how we regulate. So that can be through escalations, that could be meeting with the service provider, calling them into our offices, corresponding with them, looking for reassurances. We can issue action plans in relation to non-compliance, and of course there's prosecutions as well. As you know, these are the main themes that we look at when we're out inspecting, such as the health, welfare and development of the child, the safety of the child, management and staffing, records and documentation to support practices in service provision, and the suitability of the premises. So, at the moment, we're undergoing a lot of reform, and it started at least a year ago, and the change has been slow, so we're still building on a lot of the changes being announced in previous times, but some of the significant pieces of work has been organisational reform. So we're moving towards a nationally led inspectorate with a new line management structure. So, for instance, it'll look like this. So it's with me at the top as the main director over, of course, reporting to the CEO in Tusla. There's a national manager now in place, who's Fiona MacDonald, and we have a national registrar who will work with Fiona and myself, particularly when the registration model comes in place around registration decisions. At the moment, we've actually recruited 4 inspection and registration managers who the inspectors will now report to. Currently, they actually report to the area managers within the agency. So there's 17 area managers, and they report in to them at the moment. But that's in the next month to 2 months. That's going to all change as when those inspection and registration managers come on board. So it'll be the first time that we have a really robust line management structure. So it can only enhance the robustness, the consistency of the inspection processes. I'm also establishing 2 new teams, and this is with existing resources that we have already. A registration support team, because the registration process will involve a lot of administration, particularly from our side, and also the regulation support team around handling complaints. And if we set up a notification system, that we have a centralised function within the inspectorate. So that's essentially what it'll look like. So that's the new line management structure. And we'll be looking at centralising our legal advices as well. At the moment, a lot of it's dispersed around the country. So we'll be looking at that. And then, as I said, centralising complaints into one national complaint service that can rate complaints as they come in and send them out as required. We're also addressing risks, and that's risks that we have as a service, as an agency and as a regulator, and then risks that other services have. So there's still services out there that haven't had an inspection in some time. So we've identified them and we're targeting them, those ones in particular. We're also targeting areas of concern or services of concern that we deem to be high risk. Some of the other process improvement around what we're doing, so around consistency and how good the reports are, we've set up editorial boards and consistency groups. Now these are more, I see these more as interim pieces. Like when we have inspection and registration managers in place, it'll become much more of a management role to quality assure reports rather than having groups to do it. This should significantly speed up, the publication of reports. That's my hope. And then also the consistency of the reports, that there'll be more singular people looking at reports from a consistency basis. So to date, there's also been significant standardisation of inspection processes, which our inspectors actually find quite challenging at times because it's a big change for them. And that's something that's going to keep going. We'll keep pressing on with the standardisation of inspection processes, and at the moment we're developing new standard operating procedures, really defining down what we do so everybody's on the same page. That sameness across the inspectorate isn't fully there yet, but we're really codifying it down. So obviously publication reports is one big piece that we've done to date, and that's all available on the Pubble website, but we will be moving towards very shortly publishing on our own website in a much more user-friendly fashion. We're recruiting new inspectors, so we're going from 39 WT to 48. Now the recruitment process could be quicker, but there's a whole process to go through to get us up to that, and that will deal particularly with those risk areas. So they'll be put into those areas where there has been no inspector for some time, or there's been no inspections for some time. We'll also be moving to more thematic-based inspections, and hopefully that will happen over the next month, is that we'll select themes to focus on, particularly the more high-risk areas within the regulations. A lot of time there could be some regulations that may not be of most use, so we'll pick the ones that carry the most risk. There's additional professional development inspectors. There's regular training of the inspectors on a variety of different topics, and that's formally scheduled. And the sharing of information and best practice garnered through inspections. So The Dr. Sinead Hanifin report is an example, and we'll continue to do that on an ongoing basis, similar piece like that. And this research by Sinead Hanifin that I mentioned already, and we published that, gosh, was it 2 months ago or so? There were 2 different reports. So that report that was commissioned by Gordon Jays, our CEO, it was conducted by Sinead Hanifin, who carried out an analysis of about 3,000 inspection reports, inspections carried out between January 2012 and May 2013. So it was a very comprehensive look back. The 2 main reports out of it was the quality of the provision that's out of the inspection reports, and then also looking at our inspection process. And we made that public. Like, I've worked in other regulators and worked with regulators and been subject to regulation, and they wouldn't always be so open about publishing things that are critical of their own inspection process. Regulators tend to be a little bit more closed off when it comes to that. So I have to say that we've been very open about it. What the research covered was the quality of provision. It looked at the extent of compliance, quantified areas of compliance and non-compliance, and identified issues arising in respect of non-compliance. Then for the process of inspection, it described the reporting process and the differences, commonalities and consistencies in the reporting process, and it looked at the different thresholds for evidence applied and for giving the different gradings. So the key findings in the report in relation to the quality of provision, from the report, there's really high levels of compliance, really are exceptionally high. It's something to be commended. Now, at the same time, even though it was high, the places where there was low compliance were probably areas that were more of high risk. So I don't think that because there was high compliance that it's all great within the monitoring inspection piece. The ones that were of low compliance were quite serious things. So those are definitely areas that services need to focus on. There was also some regional and service type variation. So say HSE West had was very much the highest, which brought it up quite a lot. And then say the Dublin North East, these are the HSE regions that we operate under, the 4 of them. D&E was the lowest. And what was interesting from that is, I don't know how accurate it could be, the HSE West is where we've had the highest level of inspection activity compared to Dublin North East. So it seems that where we're more active, have been more active, there seems to be higher levels of compliance. That's a very loose bit of analysis, but it's an interesting observation, I found. We found also that drop-in services had the lowest level of compliance as far as services, and then sessional and childminding services had the highest. Generally, the areas of non-compliance were management of staffing, in particular vetting, safety of the environment, and records. In relation to the inspection practices, the report stated the process of inspection is comprehensive, wide-ranging, and forensic. Now, there were some concerns around maybe the application of thresholds, but this is something every inspectorate faces. It's very difficult when you've got 40-odd inspectors out there that they're going to apply thresholds exactly the same. So what someone feels is compliant versus what non-compliant, there's always that grey bit in the middle where it's hard to exactly know. So we're going to be working further on defining what the thresholds will be, but particularly for the new registration model, that will have clear judgment frameworks around what are the criteria under compliant and non-compliant. Report writing was also looked at as an area that could be improved. That just comes down to how some people will provide more detail about a compliance, or some will provide more about non-compliance. Just there was some inconsistencies around that. There's a need for more ongoing research and evaluation. That was one step which enabled. We're looking to build an ICT system that will hopefully give us much more rich information, that we can provide more timely information like this, that we can identify the key trends in the system and make them known to everybody. And we need to include the voice of the stakeholders. So we will start interviewing parents, staff, and such like. It's so important for triangulating down how good a service really is. And as I said already, we're moving toward, the report recommends that we move towards thematic-based inspections, and we are doing that at the moment. And just to say, the reports, I don't have them with me, but they're available on our website if you're looking to look at them in more detail. So there's a new registration model coming out soon, I think. I'll make a comment on that, I hope. All new early years service providers will have to register and undergo an inspection before commencing operation. So previously they just required to notify. So if you're a new service looking to start, you have to apply for registration with us, and you cannot commence operating until we determine or deem you fit to practice. And then within the new registration system, we'll have the power to deregister a service and also impose conditions on the service. So in the new registration system, before opening, services apply to be registered and will be given an initial determination as to the fitness to operate. So once operational, inspections carried out to determine if the registration can continue or not, and additional conditions may apply. So as I said already, there's that initial pre-registration visit, and then a couple of months later, between 3 to 6 months later, there'll be an additional inspection to see if the service is still fit for purpose. All existing services are deemed to be registered and will be re-registered within a 3-year time frame. And within that 3-year time frame, we will be prioritising high-risk services that we've identified, such as drop-in services or other ones that we have information that we may deem them to be of high risk. Now within that, that doesn't say there's only one inspection within 3 years. There will be ongoing monitoring inspections, and we'll be reacting to service that we deem high risk through triggered events. Now, you've asked, when is this going to start? Now, it's really in the hands of the department insofar as that they have to publish the regulations and the standards. It should come in the next couple of months. And our hope is then that there's a run-in period as well that comes with that before we start inspecting. Okay. Consultation. Well, the consultation's in the hands of the department more than we're handed the regulations. So it's with the Department of Children and Youth Affairs that question needs to go to. Personally, I don't know the background fully of the development of the regulations. So just for preparing for registration, this is a simple model of how you prepare to implement any standards or regulations. So new standards and regulations are published. Good idea to conduct a gap analysis against the standards or regulations. From that, you develop a quality improvement plan. So you've identified what the gaps are, what you don't have, or what you'd like to improve against the standards. Then you implement the quality improvement plan using a project plan of some kind where you scale it over a number of months. A lot of times some places want to get it all done at once, and that can be quite hazardous. So putting in place 6-month action plan, 6-month project plan to implement your QIP, and then of course review and evaluating your progress against the QIP. This is something that should happen all the time. I'd recommend that services do this on an annual basis at least to review and improve the quality of their service. And for us, in preparation obviously to develop new standard operating procedures for registration, be looking to develop a new ICT system to manage the inspection process. We will be communicating and consulting with yourselves regarding our registration model. We'll continue to enhance our ongoing reforms that I've mentioned already. And of course the development of the inspectorate is a clear commitment within our corporate plan where we talk about moving towards a risk-based and intelligence-led regulation model. So it is a clear commitment in Tusla, and it is a regular discussion point at a senior management level. So in conclusion, providers are responsible for delivering high quality and safe services for children, and Tusla and our regulators now and will be responsible for determining the fitness to operate. When necessary, of course, we will take immediate action up to including prosecution, and in future powers will include imposing conditions and potential closure through deregistration. Thank you very much. Today's